Top 10 diseases in seniors that start silently but end badly. Imagine you're 62 years old, feeling perfectly fine, going about your daily routine without a care in the world. You wake up, have your morning coffee, maybe take a walk around the neighborhood. Everything seems normal, but deep inside your body, something is quietly changing. Something that could dramatically alter your life in the coming years. What if I told you that right now, as you're watching this video, there could be a silent disease developing in your body that you won't notice until it's almost too late? These aren't rare conditions we're talking about. These are common diseases that affect millions of seniors worldwide, and they all share one terrifying characteristic. They start without showing any obvious symptoms. Today, we're going to explore 10 diseases that begin their destructive work in complete silence, often for years, before they reveal themselves when significant damage has already been done. But here's the good news. Knowledge is power, and by the end of this video, you'll know exactly what to watch for and how to protect yourself. Before we dive in, don't forget to subscribe and turn on the notification bell. Now let's get started. Number 1. Osteoporosis. Our first silent threat is osteoporosis, often called the silent bone disease. This condition weakens your bones by reducing their density and quality, making them fragile and more likely to break. The scary part about osteoporosis is that you can lose up to 20% of your bone mass without experiencing any symptoms whatsoever. Your bones are constantly breaking down and rebuilding throughout your life. However, as we age, especially after menopause in women, this process becomes unbalanced. Your body starts breaking down bone faster than it can rebuild it. This leads to hollow, porous bones that can fracture from something as simple as a sneeze or a gentle hug. The first sign many people notice is a fracture from a minor fall or even normal activity. By this time, significant bone loss has already occurred. Hip fractures are particularly dangerous. The solution lies in prevention and early detection. Regular bone density tests, especially for women over 65 and men over 70, can catch this disease early. Weight-bearing exercises, adequate calcium and vitamin D intake, and avoiding smoking and excessive alcohol can help maintain bone strength. If diagnosed early, medications can significantly slow bone loss and reduce fracture risk. Number 2. Type 2 diabetes. Type 2 diabetes is another master of disguise that can silently damage your body for years before you realize what's happening. This condition occurs when your body becomes resistant to insulin or doesn't produce enough insulin to maintain normal blood sugar levels. Unlike type 1 diabetes, which often has dramatic symptoms, type 2 diabetes can develop gradually over many years. The silent progression begins with insulin resistance. Your cells start ignoring insulin signals to absorb glucose from your blood. Your pancreas responds by producing more insulin, but eventually it can't keep up with the demand. Meanwhile, high blood sugar levels are quietly damaging your blood vessels, nerves, kidneys, and eyes. Many people live with undiagnosed diabetes for years, experiencing subtle symptoms they attribute to aging. These might include increased thirst, frequent urination, slow healing wounds, blurred vision, or persistent fatigue. However, these symptoms are often mild and develop so gradually that they're easily overlooked. The complications of untreated diabetes are severe. It can lead to heart disease, stroke, kidney failure, blindness, and nerve damage that may require amputation. However, early detection through regular blood sugar testing can prevent these complications. Lifestyle changes including a healthy diet, regular exercise, and weight management can often control type 2 diabetes. Number 3. Hypertension. High blood pressure or hypertension is nicknamed the silent killer for good reason. It's called silent because most people with high blood pressure have no symptoms, even when blood pressure readings reach dangerously high levels. This condition affects nearly half of all adults in the United States, with the risk increasing significantly with age. Blood pressure represents the force of blood pushing against your artery walls as your heart pumps. When this pressure remains consistently high, it forces your heart to work harder and puts tremendous strain on your arteries. Over time, this excess pressure damages the delicate inner lining of your arteries, creating rough spots where plaque can accumulate. The damage from high blood pressure accumulates silently over years or even decades. Your arteries gradually thicken and narrow, reducing blood flow to vital organs. Your heart muscle thickens from working overtime, becoming less efficient at pumping blood. Meanwhile, you feel perfectly fine and have no idea this internal damage is occurring. The consequences of untreated hypertension are devastating. It significantly increases your risk of heart attack, stroke, kidney disease, and heart failure. However, hypertension is easily detected with regular blood pressure checks and highly treatable with lifestyle changes and medications. Regular monitoring, maintaining a healthy weight, limiting sodium intake, exercising regularly, and managing stress can all help control blood pressure and prevent complications. Number 4. Glaucoma. Glaucoma is often called the sneak thief of sight because it can steal your vision gradually without you noticing until significant damage has occurred. This group of eye diseases damages the optic nerve, which carries visual information from your eye to your brain. The most common form, open-angle glaucoma, typically develops slowly and painlessly over many years. The problem usually begins with increased pressure inside your eye, though glaucoma can occur even with normal eye pressure. This pressure gradually damages the optic nerve fibers, starting with your peripheral vision. Since your brain is remarkably good at filling in gaps in your visual field, you might not notice vision loss until 40% or more of your optic nerve fibers are damaged. The insidious nature of glaucoma means that by the time you notice vision problems, significant irreversible damage has already occurred. You might first notice difficulty seeing things out of the corner of your eye, or you might bump into objects on your sides. Some people describe it as looking through a tunnel that gradually gets smaller. Early detection is crucial because vision loss from glaucoma cannot be restored, but further damage can be prevented. Regular comprehensive eye exams, especially after age 60, can detect glaucoma in its early stages. Treatment typically involves eye drops to reduce eye pressure, and in some cases, laser treatments or surgery. The key is catching it before you notice any vision changes. Number 5. Chronic kidney disease. Your kidneys are remarkable organs that filter waste and excess fluid from your blood, but chronic kidney disease can silently rob them of their function over many years. This condition involves the gradual loss of kidney function, and it's particularly insidious because your kidneys can lose up to 90% of their function before you experience obvious symptoms. Chronic kidney disease often develops as a complication of other conditions like diabetes, high blood pressure, or heart disease. The constant high blood sugar or blood pressure damages the tiny blood vessels in your kidneys, reducing their ability to filter waste effectively. This damage accumulates slowly over years, and your remaining healthy kidney tissue works harder to compensate. The early stages of kidney disease produce virtually no symptoms because your kidneys have tremendous reserve capacity. As the disease progresses, you might experience subtle signs like fatigue, difficulty concentrating, poor appetite, or swelling in your feet and ankles. However, these symptoms are often attributed to aging or other conditions. Advanced kidney disease can lead to complete kidney failure, requiring dialysis or kidney transplantation to survive. However, early detection through simple blood and urine tests can identify kidney problems before symptoms appear. Managing underlying conditions like diabetes and high blood pressure, staying hydrated, avoiding medications that can damage kidneys, and maintaining a healthy lifestyle can slow or prevent progression of kidney disease. Before we continue with our next silent disease, I want to remind you that this information could literally save your life or the life of someone you love. If you're finding this valuable, consider subscribing to our channel and sharing this video with family and friends who might benefit from this knowledge. Number 6. Sleep apnea. Sleep apnea is a serious sleep disorder where your breathing repeatedly stops and starts during sleep, and many people don't even realize they have it. The most common form, obstructive sleep apnea, occurs when your throat muscles relax and block your airway during sleep. This can happen hundreds of times per night, severely disrupting your sleep quality and depriving your body of oxygen. The silent nature of sleep apnea means that while you're sleeping, your brain is constantly waking you up just enough to restart breathing, but not enough for you to remember these awakenings. You might think you slept for 8 hours, but your brain never got the deep, restorative sleep it needs. This creates a cascade of health problems that develop gradually over time. During the day, you might experience chronic fatigue, difficulty concentrating, morning headaches, or irritability. However, many people attribute these symptoms to stress, aging, or other factors. Your bed partner might notice loud snoring or periods where you stop breathing, but if you sleep alone, these obvious signs go unnoticed. Untreated sleep apnea significantly increases your risk of high blood pressure, heart disease, stroke, diabetes, and depression. The repeated drops in oxygen levels put tremendous strain on your cardiovascular system. However, sleep apnea is highly treatable with devices like CPAP machines, oral appliances, or in some cases, surgery. A sleep study can diagnose the condition, and proper treatment can dramatically improve your health and quality of life. Number 7. Atrial fibrillation. Atrial fibrillation, often called AFib, is an irregular heartbeat that can significantly increase your risk of stroke and heart failure. In this condition, the upper chambers of your heart beat chaotically and irregularly, preventing proper blood flow. The frightening aspect of AFib is that many people experience no symptoms at all, especially in the early stages. AFib occurs when the electrical signals that coordinate your heartbeat become disorganized. Instead of contracting in a coordinated manner, the atria quiver ineffectively. This irregular rhythm can cause blood to pool in the heart chambers, potentially forming clots that can travel to the brain and cause a stroke. Some people with AFib experience palpitations, shortness of breath, chest pain, or fatigue. However, others feel completely normal and have no idea their heart rhythm is irregular. This silent AFib is particularly dangerous because people don't seek treatment for a condition they don't know they have. The risk of stroke from untreated AFib is 5 times higher than in people with normal heart rhythms. However, once diagnosed, AFib can be effectively managed with medications to control heart rate and rhythm and blood thinners to prevent clots. Regular checkups and being aware of irregular heartbeats can lead to early detection. If you ever notice your heart beating irregularly, skipping beats, or racing unexpectedly, it's important to see your doctor promptly. Number 8. Peripheral artery disease. Peripheral artery disease, or PAD, is a circulatory condition where narrowed arteries reduce blood flow to your arms and legs. This disease shares many similarities with coronary artery disease, but instead of affecting the arteries around your heart, it affects the arteries that supply blood to your extremities. The development of PAD is often silent in its early stages. PAD typically results from atherosclerosis, where fatty deposits build up in your artery walls, causing them to narrow and harden. This process happens gradually over many years, and your body often develops small blood vessels around the blockages to maintain circulation. This natural bypass system can mask symptoms for a long time. The classic symptom of PAD is claudication, which is pain or cramping in your legs during physical activity that goes away with rest. However, many people don't experience this symptom, especially if they're not very active. Some people notice that their legs feel cold, numb, or weak, or that wounds on their feet or legs heal slowly. Untreated PAD can lead to serious complications including non-healing wounds, infections, and in severe cases, amputation. It also indicates that you likely have atherosclerosis in other parts of your body, significantly increasing your risk of heart attack and stroke. Early detection through simple tests like the ankle brachial index can identify PAD before complications occur. Treatment includes lifestyle changes, medications, and in some cases, procedures to open blocked arteries. Number 9. Macular degeneration. Age-related macular degeneration is the leading cause of vision loss in people over 50, and it often begins its destructive work years before you notice any vision changes. This disease affects the macula, the central part of your retina responsible for sharp, central vision needed for activities like reading, driving, and recognizing faces. There are 2 main types of macular degeneration. The dry form, which is more common, involves the gradual breakdown of light-sensitive cells in the macula. The wet form involves abnormal blood vessels growing under the retina. Both forms can develop silently, with the dry form typically progressing slowly over many years. In the early stages, you might not notice any vision changes at all. As the disease progresses, you might experience subtle changes like slightly blurred vision, difficulty reading in dim light, or colors appearing less vibrant. Some people notice a small dark or empty area in the center of their vision that gradually grows larger. While there's no cure for macular degeneration, early detection and treatment can slow its progression and help preserve your vision. Regular eye exams can detect early signs before you notice symptoms. For the wet form, injections can help prevent further vision loss. Lifestyle factors like not smoking, eating a diet rich in leafy greens and fish, wearing sunglasses, and maintaining a healthy weight may help reduce your risk. Number 10. Osteoarthritis. Our final silent disease is osteoarthritis, the most common form of arthritis that affects millions of seniors worldwide. This condition involves the gradual breakdown of cartilage, the smooth tissue that cushions the ends of bones in your joints. What makes osteoarthritis particularly insidious is that significant cartilage damage can occur before you experience any pain or stiffness. Osteoarthritis develops when the cartilage in your joints begins to break down faster than your body can repair it. This can happen due to normal wear and tear over time, previous injuries, genetics, or excess weight putting additional stress on your joints. The process typically begins in your 40s or 50s, but may not cause symptoms for years. The early signs of osteoarthritis are often subtle and intermittent. You might notice slight stiffness in the morning that improves with movement or minor aches after physical activity. Many people dismiss these early symptoms as normal signs of aging. However, as cartilage continues to deteriorate, bones may begin to rub against each other, causing pain, swelling, and reduced mobility. Advanced osteoarthritis can significantly impact your quality of life, making simple activities like climbing stairs or opening jars painful and difficult. However, early intervention can slow the progression and manage symptoms effectively. Regular exercise to strengthen muscles around joints, maintaining a healthy weight, protecting joints from injury, and working with healthcare providers to develop a management plan can help you maintain mobility and independence as you age. As we've explored today, these 10 diseases share a common and frightening characteristic. They begin their destructive work silently, often for years, before revealing themselves when significant damage has already been done. Osteoporosis weakens your bones, diabetes damages your blood vessels, hypertension strains your heart, and glaucoma steals your sight. Each of these conditions can dramatically impact your quality of life if left undetected and untreated. But here's the empowering truth that I want you to take away from this video. Knowledge truly is power when it comes to your health. Now that you understand these silent threats, you're equipped to take proactive steps to protect yourself. Regular health screenings, maintaining a healthy lifestyle, and being aware of subtle changes in your body can make the difference between catching these diseases early when they're manageable or dealing with their devastating complications later. Remember that aging doesn't mean you have to accept declining health as inevitable. Many of these conditions are preventable or manageable with early detection and proper care. Work closely with your healthcare providers, stay informed about your health risks, and don't ignore subtle symptoms that might indicate a problem. This video is intended for informational and educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. If you have any symptoms, discomfort, or health concerns, please consult your doctor or a qualified healthcare provider. Always speak with your doctor before making any changes to your diet, supplements, or lifestyle. If this video has helped you understand these important health risks, please give it a like and consider subscribing for more valuable health information. Share this video with family and friends who might benefit from this knowledge. Until next time, stay healthy and stay informed.